Most respected Dr. Joseph Matthew, the president of QPMBA, respected PH Kurian sir, respected RV Ashogan sir, respected Dr. Sulfi, respected Mr. Muhammad Arif, respected Baby sir, my friend Dr. Chandramohan, respected Dr. Abu Bakr sir, Dr. Ashogan sir, Dr. Benny, friends, very good evening to one and all. It's my pleasure and privilege to be a part of this wonderful evening. At the outset, let me declare the job assigned to me is to launch job portal. Maybe because we are running a medical college, that might be one of the reasons why Dr. Devin thought to launch this job portal by me itself. So I declare job portal is inaugurated. Okay, thank you. As far as I'm concerned, Dr. Ashogan sir and Kurian sir and Dr. Sulfi spoke so much about the difficulties and the challenges what doctors are having. But being in a medical school for the last 20 years, running a medical institution, what I understand is even if you have another 1,000 doctors in our country, sir said we have almost 10 lakhs of aspirants were there. 10 lakhs of them returned NEET. Out of that, only 1 lakh seats were there. So what about the other 9 lakhs? If you don't have seats here, they will go outside the country. They will pursue education there. They will come back. So we cannot stop sort of producing more doctors in our country. If you don't have it here, they go to nearby countries. There are ways. So it is all about the need of the world. At present, what I understand is whichever part of the world you go, there are huge demand for healthcare professionals. Our strength is our population, maybe 1.4 billion population. That is why we have a lot of issues because of that population. But one advantage is that we can have more talented personnel from our country. So that I think that is whenever we have issues, there will be some opportunities also. So what in my perspective, I always look at the opportunities or I'm a little bit optimistic about things. That is the reason maybe I'm talking even if you have another thousands or a lakh of doctor coming out of medical institution, we have sufficient space in this world. I don't mean that Kerala, because Kerala is exception. It has been already told by Kurian sir also way back in 1970s and 80s and all, we didn't have much problem. Even today, the same thing is happening. And what I heard from the speaker, spoke a little before that if you have corporate hospital, it's going to abolish the single doctors clinics or the medical centers and all. I don't think that's going to happen, because as time goes, what I believe is that the technology is going to evolve. If you don't create the modern hospitals, what will happen if people will go from here to the next station or next state or next country? Because that is going to happen, because the diseases are very complex. You need technology to come in. You have to invest, and for that investment, you need to have more people coming forward. That doesn't mean that doctors who are practicing in the rural or in the suburban places, they don't have space. They have place. But for that, what we need to do is we have to make people to understand that it is not that when you have a headache, go to a neurologist or go to a corporate hospital. Or when you have some stomach pain, you go to a gastroenterologist or a hospital like PRS or KIMS or GG. It is not like that. They can go to a primary hospital, what is there in the West. So such cultural changes has to be brought in. It is not that corporate hospital are there to sort of abolish the small and medium hospital. I can watch from the corporate hospital side that I have not seen. I have met so many corporate leaders in Kerala, where when I speak about the issues what is there among the doctors, they're always very keen to come forward and sort it out. I mean, what I'm trying to convey is that we all have to come together, and we should have a single voice, as what P.H. Kurian sir said, we have to stand together. There are issues. There will be issues also. It is not going to die down soon. Our priority should be how safe our place or our hospital or even your clinic is for you to practice. Without fear, without any worries, you should be able to treat. Unless you have that space, I don't think we are reaching anywhere, because we all have to stand together. If I am in a different boat, you are in a different boat, or if you go to a different direction, I go to a different direction, things will not work for health industry. We have to stand together. This is very well known to corporate sector. That is the reason they always come after doctors, because ultimately, without doctors, no hospital can thrive. And there is a wrong notion in the society that the hospital industry or the doctors are making a lot of money, or it is a lucrative business. That's the reason why people are investing. And I'm sure that we have Dr. Ashokan and Murugan sir is here. We have a lot of difficulties in the hospital industry. It is nothing that they make a lot of money out of it, because day in and out we discuss. Bank, I think we have SBI is here. They know how much debts is there for so many hospitals in Kerala. They are bankrupt. So many hospitals are bankrupt. They are not even able to pay the salary of nurses. That is the reason why nurses are creating havoc in the society. Having said that, I don't take anything away from all doctors who are running small and medium hospitals. You are the backbone of our health industry. And as far as Kerala is concerned, we know that where we stand. We have a very robust, public healthcare system in our state, particularly. But when it comes to private sector, even though the major number of patients are getting treated at the private hospitals, but still we are not getting any support from the government nor the society. Particularly the media. I'm sure that the media, recently I saw one news from one of the leading newspaper that hereafter, I think NMC has come out with a law that the doctors are not supposed to give away their opinion just for the advertisement sake. And because social media platform are used not only by doctors, even quacks, sometimes we don't understand. So the media people also, they have to show some courtesy towards doctor, because doctors, when they practice with so much of commitment. This is what I believe. 99% of the doctors are not for money. That's what I believe. Maybe as you see in any industry, you get to see black sheep. Like that in our industry also we have. But that doesn't mean that most of the people, when you see the news media or electronic media, we have a feeling that at least the public has a feeling that the hospital industry and doctors are there to make money. So I don't want to take much of your time, because I understand this is more of an academic event, and once this is over, I'm sure that Dr. Devin also take this conference forward. So all I want to say is that we all have to stay together as a unit, whether you are running a small hospital or a big hospital. From Gokulam Medical College, I am treating very poor patients only. It is not that someone told, Baby sir only told that they'll go off to Gokulam Medical College. We have very poor patients coming in. Even patients, 90% of our patients are from RSBY category. That means they are very poor. They cannot afford to go to any even private clinic also. Such people are coming to our hospital. The thing is that there are so much of issues in our industry that has to be addressed, and we need support from the government. We need support from the public, and the media part also have to be taken care. Because I believe that we run a media house, and a lot of issues are there for the media house also. So what they think that to make money, I don't want to make a controversial statement here, because I know that social media is so strong that if you make some comments, it might go. I see the camera, so I keep myself away from that statement. But still, the print media as well as electronic media, they have to be a little more responsible. Before they making a comment about a hospital or about a doctor, I think they have to understand in depth about what treatment was given to the patient, without knowing that they blow things out of proportion and create havoc in the society. That might be one of the reasons why, the people come after hospital or doctor, then whack them, hit them, and, they bombard the hospital and go away. So there is a different perception about the hospital industry. I think this is what we have to change. We have to come together. We have to change the notion about the health industry. At least I can vouch for the hospitals and doctors in Kerala. They are not for so much about what's been talked in the media, and in the even in the political arena. This is what they talk. So at least doctors, we have to come together. This is my the bottom line. And with this note, let me announce once again, job portal is inaugurated. Thank you, and I wish QPMPA my best wishes. Thank you.